New technology used in joint replacements has allowed patients to go home within the same day and with less pain. Orthopedic surgeon Dr. Joey Nelson with Dignity Health is here to tell us more. Good morning, doctor. How you doing?
Doing great. Thank you for having me.
Yeah, well, thanks for being here. So we get to talk about something that's really exciting today, and that is the advancements in joint replacement. So tell me a little bit about some of these new things you guys are doing.
Yeah, joint replacements, hip and knee replacements specifically, which is what I do, have come a long way in the last 5 years, but really in the last 20 years especially. In the last 5 years, we've started adding more robotic technology. So I do a lot of robotic total knee replacements, a lot of computer navigation. That's come on in the last 5 years, but in the forefront of things coming up, there's a lot of new implants coming out with smart technology, which, everything is getting smarter. So there's new devices that can help patients, that can communicate with your phone, that can tell you how your knee is doing and give you range of motion, all sorts of different topics or different measurements
Updates
to help you
like that.
know what's going on.
If we have smart fridges, why wouldn't we have smart joint replacements? That's incredible. So tell me some of the things so you get a hip replacement, let's say. You go to your phone, maybe you're feeling, a little achy or whatever it might be. You go to your phone, what all can you check? What all can you see in that app?
That's great. So mostly the biggest, the new smart technology is mostly in the knee. It's coming in the hip, but right now it's in the knee.
So more in the knee than the hip, but cool.
Right.
So you had a knee replacement.
Yep.
What would you be able to see there?
Yeah, so there is a sensor that goes on to the bottom part of the knee, which is called the tibia. And on the bottom of that, it's a small little stem, which we put on most knee replacements anyway. And that communicates to your phone. That will give you measurements of range of motion to tell you how you're doing. It'll let you compare to the average person. It will tell you what your stride length looks like, how long your steps are, how many steps you're taking, and you can track that over time. And if something happens to where you're doing well and then you have a setback, it'll actually ping me and let me know so I can reach out to you and say, hey, something's happening. I need you to come in and let's check on it.
And I'll bet that makes surgery, you tell me, but my guess would be that makes any other surgeries you would need so much easier because you can already be totally dialed into what you need to do.
Exactly. And that same platform gives the patient the ability to reach out to me directly via text or via message that they can send me. Also with this technology, when I do my knee replacements, which I do robotically, I can set in there exactly what measurements and everything I took robotically so I can follow your recovery, knowing what type of implant I put in and at what angle and all the different rotation and whatnot.
So tell me, you were getting into the robotics a little bit. Tell me a little bit more about that. Are the robotics more the tools that you are using, or does that encompass what goes in the knee as well?
Mostly it just is what I am using. So
Gotcha.
Robotic knee, you usually still have the same incision on the front of the knee, and then sometimes another small incision down lower on the tibia. And that incision on the tibia will help me communicate with the robot. And so the robot is something that can help me be accurate within less than 0.5 millimeters and 1 degree of rotation. And so I trained without the robot intentionally because I need to know how to do it in case the robot's not doing what I want it to.
Because technology, sometimes that happens.
And so you can't just fully rely on technology. But if for the most part, it is 99% of the time when it's accurate, it is right on.
It's right on.
And I've seen a lot of patients that come back, and in my practice, people are doing very well coming back after those robotic surgeries when I can dial in exactly how I want that knee to go in.
Man, that is really cool. Okay, so you mentioned a little bit about the scar. I have a question because I want to know. So you guys said this is not your grandfather's knee replacement. How big is a traditional scar, say from 20, 30 years ago, compared to these scars? Are they about the same, or is it a drastic difference? Are they much smaller?
Yeah, every surgeon's is a little bit different. I can look at someone's scar and probably tell you what surgeon did your knee in the local area. But for the most part, it just goes a little bit above your kneecap and a little bit down what we call a tibial tubercle, that bump that you feel on the front of the knee.
Gotcha.
It usually is about that long for the most part. Historically, it went almost halfway up the thigh and halfway down the shin. So it has shrunk significantly from how they used to do them.
Yeah, it's getting smarter, it's getting better. I love all of this technology update. This is really, really cool. So give us a little bit of information on if somebody at home wants to learn more, can they go online and find any information from you guys at Dignity Health?
Yeah, so they can go onto our website, which is dignityhealth.org/azortho. So they can find out more about us on there, and they'll be able to find out more about what we do, each of the other surgeons in our practice. And so for us, that's how you'd find more information about us or making an appointment with us. But there are also, depending on what implants we use and what robot we use, you can also go in and search up what those kind of things are as well.
Do the research behind it. Yeah, absolutely. You want to know what you're doing for your own personal procedure. Yeah, I love that. Well, doctor, thank you so much. This was great. Thank you guys so much, and stay tuned for more.